shoulder dislocations. Only on shoulder dislocations I want to talk. So I get many MRI reports. Sir, I have repeated shoulder dislocations. What to do? They will send their MRI report. Friends, as I said multiple times, so we need to see what is their main problem. What is their main problem? Are they not able to do their daily routine activities? Are they finding any pain, any restricted range of movements, any stiffness? So, what is their age? What is their occupation? Is he a student? Is he a farmer? Is he a software employee? Is he a sports person? We need to see these things. And what are his expectations? What are his demands? Number one. Okay. Number two, some patients will have convulsions. Some patients will have convulsions, epilepsy. So we need to see this. Sometimes we need to take a neurologist opinion as well, because if the patient is on fits or convulsions, so what medicines is he taking? What type of fits it is? So is he on medicines or not? Did he stop taking medicines? So these things we need to check. Okay. So basically the MRI is to see. Basically the MRI is to see how is the bankards. Okay. And what is the level, what is the extent, number one. Number two, how is the hill sacs, so how is the defect, what is the size of the defect. So if there are multiple shoulder dislocations, okay, and it is there from many years, so to see the exact bone loss, we ask for a CT scan shoulder also to see the percentage of the glenoid bone loss. Okay, so because after some critical percentage of the glenoid bone loss, we need to do a Latarjet procedure. Okay, so if you have any shoulder problem, please don't think all shoulder problems are same. Okay, so by and large there are few shoulder problems. I'll just tell you. One is recurrent shoulder dislocation, which is very common in the young population. Okay. Number two, rotator cuff tears. Sometimes it can be a partial tear, sometimes it can be a full thickness tear. We are seeing a lot of frozen shoulder. Okay, these are the some patients can have impingement, some patients can have biceps tendinitis, some patients can have AC joint arthritis. Okay. So some patients can have glenohumeral arthritis. So these are the patients what we see regularly in our OP practice. So all shoulder pains are not same. Okay, we need to examine the patient. Number one, do the necessary investigations like X-ray, MRI, if needed CT scan, then plan accordingly. So the next doubt what the patient gets for the shoulder bankards is the how much time it will take for the surgery. Roughly it will take 2 to 3 hours, not more than, usually 2 to 3 hours. Okay, what position we will do? Position usually patients will not ask. We will give the GA, full body anesthesia usually. If we do surgery today, we will discharge either tomorrow or day after tomorrow. Okay, it is done under arthroscopy procedure. It is done with a very hardly 1 to 2 centimeter incision. We do the surgery. Okay, we do with 1 to 2 centimeter incisions, not more than that. So basically the portals will be the regular posterior portal and the anterior superior portal and the anterior inferior portal. Okay, through the anterior inferior portal we put the anchors, we take the bite, it is more or less like a working portal, and anterior superior portal is the it is for the placement of the sutures. Okay, so if you have any doubts, and we discharge, I told next day only, I told, then we put a arm pouch for about 1 month. You have to wear the arm pouch. Okay, then gentle movements we start. Sometimes we start early, sometimes after 4 weeks we start the gentle movements, the gentle pendulum exercises. Okay, so if you have any doubts on shoulder dislocation, you can ask. So usually I use all suture anchors. I don't use metal anchors. I use all suture anchors, okay, which is not seen in the X-ray. For the hill sack, sometimes I might use titanium, but majority of the times for the bankards I use all suture anchors. Okay. So if you have any doubts about shoulder, please ask. If you are not able to pay the fee, no problem. You can come and you can just message me. I'll see for free, not a issue. One person is asking, sir, how is pediatrics as PG branch? Is there upcoming growth? Sir, I get things, sir. See, go by your. See, if you are interested in pediatrics, just go by it. If you are having interest in orthopedics, take orthopedics. Don't worry about the saturation and all, because saturation is there in every branch, in every specialty. Okay. If you are having interest in cardiology, take cardiology. That's it. Okay. Don't worry whether it is saturated or not, because nowadays every branch is saturated. Every branch, even DM cardiology students, I mean PGs who clear DM cardiology are also not able to find proper job in Hyderabad. That is the level of competition. That is the level of saturation in Hyderabad. Okay. Now neurology and gastroenterology people are finding better jobs. Okay. Regarding this topic, we'll make another video. Okay. So thank you, friends. If you have any doubts about shoulder dislocation, you can confidently ask me. Okay. Thank you.